deeply regret the disruption to patients. We've accepted in full the independent pay review body recommendations, and I think it's important now that the trade unions do likewise. So any disruption to patients in terms of operations being cancelled is deeply regrettable, and that's why it's important we get back to talks. We look at the range of issues that are impacting on nursing, the consequences of the pandemic, and how we work together in the interests of patients. And that's what we prioritised in the autumn statement with the extra £6.6 billion of funding. And I urge Pat Cullen and the RCN to do likewise, to come to those talks and focus on how we work together in the interests of patients.
You say you want to get back to talks with the unions. They're saying you won't talk about their key demand, which is pay. What's the point?
Well, I don't think a 19% pay rise at a time when many of your viewers are already facing cost of living pressures is reasonable. We have an independent process that looks at the challenges on pay and what is affordable and what is right for the NHS, and that independent process has made recommendations, and we've accepted those recommendations in full. And of course that comes on top of prioritising the NHS last year at a time when other public sector workers had a pay freeze, and we prioritised the NHS with a 3% pay rise. But it's not just pay. When I'm talking to nurses, as I am again today, that they raise with me, they also talk about the estate and our new hospitals building programme being really important to them. They talk about frustrations often with technology and how we need to invest more in that. They talk sometimes about some of the abuse that they receive and issues of safety and how we can work together to improve safety for staff. So there's a range of issues that are raised by nurses with me. Pay is a factor, and that's why we have an independent process to look at that. But there's a range of other things that also matter to staff, and I'm keen to work with the trade unions to address those concerns as well.
These recommendations came before the war in Ukraine, and you ignored the pay review bodies last year in 4 other sectors, including judges and civil servants. So what's the difference here? Well,
we respected the pay review bodies in terms of health because of the prioritisation that we have given to the NHS, and that was also reflected in the extra funding that we've targeted towards the NHS. So it is a key priority of the government. That's why we put an extra £6.6 billion into the NHS at the autumn statement. And it's also why we recognise the pressure on the NHS as a result of those patients who are ready to leave hospital but are unable to do so because of social care. And at the autumn statement, the Chancellor put the biggest increase ever into social care funding, an extra 200,000 domiciliary care packages over the next 2 years to further take pressure off the NHS. So we are prioritising funding to the NHS and to social care. We need to focus on patients and addressing the backlogs that we have, particularly the waiting list for operations as a result of the pandemic. And that's why it's important that we work together, and I'm very keen to continue those talks with the RCN and other trade unions so we can mitigate any impact on patient safety.
If an elderly person falls and breaks their hip on Wednesday, should they call 999? Will an ambulance be available?
Well, the advice is if there is a need to call an ambulance, people should continue to do so. And of course, the GPs continue to be open, and where people have an appointment, they should continue to attend those unless they're advised not to do so. So people should continue to call 999 where they need an ambulance, but there will be impacts on patients as a result of the strike action, and that's why I'm calling on the trade unions to make good on their statements that they will protect those with life-threatening conditions and emergency responses, ensure we have the cover on Wednesday to respond to those calls. That's what they've said publicly, but if, for example, they only allow staff to respond from the picket line, that will add further delay to the response times, which is not in the patient's interest.
Do you have a plan to stop these strikes this week, or do you think it's too late?
Well, my door is open, and I continue to have discussions with trade unions. I'm keen to work with them on a range of issues that they've raised with me, because what staff say is whilst pay is a factor, and that's why we have the independent process, it's not the only factor that impacts on staff morale. And there's a range of other areas where we can work together with the trade unions to address other concerns, and I'm keen to have those discussions.
Are you in favour of one-off payments, do you know? nurses?
Well, we have an independent process in terms of the pay review body. That is the right way that we should look at these issues, and that is what the government has done, and we've accepted those recommendations in full. It's the trade unions that are not accepting the independent pay review process and not accepting those pay recommendations, and I'm keen that they do so we can get the discussions onto the many other areas where we can work together.
And finally, do any of your Cabinet colleagues think you should be going further and paying them more?
Well, discussion in Cabinet is always a matter for the Cabinet. What the government agrees and Cabinet colleagues agree is that we have a process around the independent pay review bodies. That is how we look at these issues in the round, and it's about getting the balance right between what is right for the NHS, and we saw that extra investment in the autumn statement, an extra £6.6 billion into the NHS, record additional funding into social care, but there has to be balanced also with what is affordable to the economy as a whole for your viewers who already face pressures from the cost of living, and a 19% pay demand, which is far in excess of what most of your viewers themselves will be receiving, is not affordable. So we've got to get that balance right between what is the right thing to do on pay and what is the right thing to do in terms of getting the pandemic backlogs down and really focusing in on the needs of patients.